Before starting any treatment, be sure to carefully read the user manual for warnings, contraindications, and indications for use. Take a detailed patient medical and physical history, including previous treatment methods. Have the patient sign the consent form, review the patient history, and determine if the patient is suitable for treatment. Do not treat patients with any contraindications. Remove jewelry and piercing. Clean with soap and water. Dry completely after cleaning. Apply a thin layer of TriPollar preparation gel. Press play on the treatment screen. The green LED on the applicator starts blinking, indicating that the program is loading. To start treatment, press the Start button on the applicator. RF energy is transmitted to the electrodes, and the LED indicator light turns blue. Divide the face into 5 treatment areas: right cheek, left cheek, forehead, around the eyes, and around the mouth. 5 minutes of treatment per area. Start the treatment on the jawline. Place the 4 electrode tips against the skin and apply slight pressure. Slowly move the device in circular or figure 8 movements over a small area, about twice the size of the head of the device. It is important to keep the device constantly moving and that all 4 electrodes are in contact with the skin at all times. Be sure to communicate with your patient for feedback. When the skin has reached the optimal temperature, the orange light turns on. If you didn't reach the target temperature within 2 minutes, you may increase the RF power. When the orange light starts blinking, continue the slow circular movements over the same area for a few more seconds, and then slowly expand to an adjacent area. Heat the entire treatment sections in the treatment area for 5 minutes. Make sure that the orange light is on during the entire treatment time. The TriPollar applicator has a safety mechanism. Once the maximal temperature has been achieved, the RF emission is shut off. An alert is sound and the blue LED indicator will turn green. In this case, expand the treatment area and the RF will automatically restart. During the treatment, some skin erythema or edema may develop to a different extent. These signs are indications of the heating process. A beep will sound 1 minute before the end of the session, and again at the end of the session. Thoroughly clean the gel off the face and proceed to the next session. Choose the right treatment kit based on the skin analysis and indication. Attach a new single-use OxyPod to the OxyGeneo applicator. Open a sachet of the primer gel and squeeze the contents into a clean bowl. Apply a thick layer of the gel using a brush on the entire treatment area. Press play on the treatment screen and start the treatment by pressing the On button on the applicator. Work in circular or linear movements, using mild pressure over the entire chosen area. The goal is to cover the entire area with a layer of CO2 bubbles. Avoid contact with eyes and mouth. Add more gel to the treated area if needed and continue treatment. To adjust the intensity, press the plus/minus button on the applicator. About 2 minutes into the session, the OxyPod becomes grainy. Communicate with the patient for feedback and reduce pressure if needed. A beep will sound 1 minute before the end of the session and again at the end of the session. Detach the OxyPod and dispose of it. Remove the gel and clean the treatment areas as preparation for the next step. The system will indicate you to connect the ultrasound applicator. Disconnect the RF applicator and connect the ultrasound applicator after 6 seconds. The platform will recognize the ultrasound applicator and you may proceed with the treatment protocol. Open a sachet of the serum from the kit and apply the serum on the treated area. Press play on the treatment screen. A green light will blink on the applicator. Place the applicator on the face and press the on button on the applicator. The blue light will turn on, indicating that a treatment program is running. Work in circular or linear movements, using mild pressure over the entire area. Avoid contact with eyes and mouth. Be sure to maintain full contact and constant movement of the applicator on the skin. If you want to adjust the parameters, pause the session by pressing on the applicator button before taking off the face and adjust parameters on the treatment screen. To restart procedure, first put the applicator on the face, then press the start button again. A beep will sound 1 minute before the end of the session, and a final beep will sound when the session is completed. You may finish the treatment with the massage session. It is recommended to use a hydrating mask or cream with SPF for post-treatment. Clean the applicators with 70% alcohol and antibacterial wipes.